Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, authorities are set to impose tighter restrictions on both the unvaccinated and partially vaccinated workers taking public transportation. As the campaign period for the 2022 elections draws near, what rules are in place while the country deals with the Omicron variant threat? Interior Undersecretary and spokesperson Jonathan Malaya joins us live. Also, a medical group is pushing the government to hold national vaccination days for children. Philippine Medical Association President Atienza also joins us live. A medical group is proposing to hold national vaccination days for children. The Philippine Medical Association says the move will ensure more time for parents to bring their kids to the vaccination sites. The vaccination rollout for children aged 5 to 11 is set to begin on February 4. Let's go straight to the source of the story. First off, we have Philippine Medical Association President Dr. Atienza. Dr. Atienza, welcome to The Source. Maraming salamat po sa inyong oras.
Good morning to all of you, especially for our listeners, especially the mothers of kids up there.
Opo, we will dedicate this, of course, to the vaccination on the aged 5 to 11 years old that is set on February 4. Ano po? Dr. Atienza, unang-una po, gusto ko pong tanungin sa inyo, ano po bang biggest concern ninyo ng PMA regarding the vaccination of aged 5 to 11?
First of all, our concern is that we have a special age group, the 5 to 11, and we know naman that the children have different moods in the vaccination. They need a proper orientation, especially the parents. They should know paano natin sila babakunahan, how to give them the vaccine, and they should know that they have different dose. They will be given the 0.2 ml of the vaccine, and the only brand will be given to them with EUA is the Pfizer brand po. And we should teach our parents paano kahalagahan ng ating pagbabakuna and why should we give them the vaccine. And this time of na bumababa na po yung cases of the COVID-19 cases in the NCR, this is the best time to give the vaccine para makalabas po sila. And we are coordinating with our other pediatricians all over the country, the PIDSP, Pediatric Infectious Disease Society at saka po Philippine Pediatric Society of the Philippine Pediatric Society for this rollout po para po magamit natin especially those children with comorbidities. They should be given the vaccine, screened and given the vaccine in different hospitals po that will be coordinated with different LGUs, especially here in NCR.
I want to follow up on that, what you said, especially the kids. We're really talking about right now 5 to 11 lang po para malinaw po yung ating diskusyon. Yung pong may mga comorbidities, ano ho ba ang dapat tandaan ng mga magulang, and should there be issues or problems or concerns regarding these kids who have comorbidities? Or is it safe for them to be able to vaccinate their kids with a Pfizer vaccine?
Yes, kasi dumaan na po yan sa EUA, emergency use, like in Europe, in US, and at the same time here, dumaan na po yan sa ating HSTAC and FDA. And we should para lang lahat po ng katulad po ng sa adult, lahat ng comorbidities, they should have meron silang certificate, authorization from their doctors or pediatrician in case sa mga bata, and they should be given ample time para ma-explain to sa parents, especially and the kid, bakit siya bibigyan ng vaccine. Kasi this is our priorities kasi yung comorbidities, pag nagkaroon ng COVID, sila yung vulnerable sa magkaroon ng sakit. And we should emphasize that the vaccines is for them protection for the severe and death due to COVID.
Opo. It's
And
good
through
for
this
parents.
yes.
It's good for parents, no, doctor, to be able to understand that and to be able to relay that to their children para po maging
Yes.
sorry about that. Para po maging komportable yung mga bata during the vaccination.
Yes, as pediatrician kasi, pag nagbabakuna kami ng regular vaccines namin, they told to the parents the importance of the vaccination. Ano itong bakuna na to? Hindi ibig sabihin na nabakunahan ka na hindi ka na magkakaroon ng sakit. And we always emphasize that hindi siya magkakaroon ng matinding sakit against that. Like in polio, like ito katulad din naman to ng mga bakuna natin, like the polio, the measles, the other vaccines na hindi lahat 100%, kaya nga lang maano yung mami-minimize yung mga complications lalo sa mga may comorbidity.
So now that
And we always
understand
emphasize that po.
Yeah, and we keep saying that, ano po, Dr. Atienza, na this will really prevent you from getting severe cases, no, or even critical cases. But kayo na po ang kumausap na rin sa mga magulang ngayon. Apart from the dosage na ibibigay ng gobyerno doon sa mga minors na 5 to 11, meron po kasi ding mga gamot. Para pong tayo, hindi ho ba, na inirekomenda sa atin, for example, pwede pong magparacetamol kung meron pong fever, etc. Ano ho ba ang dapat paghandaan ng magulang para po sa kanilang mga bata in terms of yung mga gamot na kailangan inumin?
Yes, kaya nga po ang kinakailangan natin, malaman natin kung sino yung may mga allergy, tapos yung may mga comorbidities. Kung wala naman po, ang pinaliliwanag natin sa ating mga magulang na karaniwang mga na mararamdaman ng mga bata after vaccination is the pain over the injection site kung saan po binakunahan. Then, usually, nagkakaroon sila ng low-grade fever, o minsan mataas. Kaya po, importante na malaman nila kasi in dosing ng paracetamol na ibibigay sa kanila during the, kung magkalagnat o may masakit, anong dose po. Kasi ang paracetamol po binibigay natin, depende doon sa, sa dose. At saka po para malaman ng mga mag-i-screen sa kanila, kasi ini-screen po lahat yan bago natin bakunahan, especially the children. Alam na po ng mga malaman nila, ay mas maganda nga kung sino yung nag-screen, siya na magbakuna. Kung ano yung po yung sinasabi natin, kung may comorbidity, direkta na screen, tapos sila natin ang magbakuna. Rather than pupunta doon sa pediatrician o sa magpapa-screen, then pupunta sa vaccination center. Yun po sinasuggest ng Philippine Pediatric Society. Nakausap ko na yung presidente po at saka HSP na mag-alat po tayo ng mga hospitals para po doon sa may comorbidity kasi ito po yung ating priority sa age group na 5 to 11. Then the rest po, kung wala namang comorbidity, they will go to the vaccination centers na we suggest na the vaccination center will be free yung flowing ng air, maluwang like the gym, and conducive for sa bata kasi the kids, maano po yan, as we say, maiirita yan kung matagal sila doon and they should give yung magagawa ng mga lalo na yung mga 5 years old, 6 years old, makukulit yan. Sana meron tayong video, mapapanood sila. Yung parang nasa sila, conducive sa bata yung hitsura. Kung walang playground, may makita sila kasi may nagsuggest na sana may playground. Kasi sa time na baka lalong magkaroon ng super spreader in the area, and we say na pwede silang bigyan ng like things na laruan or cookies habang naghihintay para maaliw naman sila at hindi matakot during vaccination.
So those are the
that's why
possible
we
adverse.
recommend that separate.
Yeah, I want to go there, but I just want to follow up on the adverse events, no? So yung pwedeng pain on the injection site and even a fever. But I wanted to find out from you, Dr. Atienza, gaano ho ba ka-sensitive ang pagpapabakuna for this particular age group?
Actually, as like other vaccines, so far ako, week 1 lang ako nakakita ng talaga nag-fever na mataas. Like that lang, ano lang naman yan, 1 in a million or ganun po. Pero dapat alam po, hindi natin alam yung ano, lalo rin yung allergies. Kaya po, sinasabi natin na alam dapat yung pedya niya. Kasi like magpapakuna, we give them our number para kung in case na meron silang naramdaman or other things na aside from fever o kaya may history na seizure yung bata o nagkukumbulsyon, we give them the necessary precautions anong gagawin. That's why this is important na they have to stay 15 to 30 minutes after vaccination and they have the number of their doctors para mag-ano po kami, para may tatawagan sila kung ano yung mangyayari. Kasi the problem of the children, kung minsan nagsasalita or that, makikita lang ng mother. This is the important thing that we should, we suggested sana Sabado walang pasok ang parents para after yung first 24 hours, mabantayan niya yung anak niya ng Sunday, wala siyang pasok. Rather than ilagay natin sa ibang days.
That's why you were pushing for number 1, separate vaccination center for the 5 to 11 and also vaccination day for them. That's what you're saying para po masamahan ng mga magulang at mabantayan yung kanilang mga anak. Hindi lang dun sa araw na yon and even 24 hours later.
Yes po.
All right. So we're going to see, Dr. Atienza, if government will heed ito pong tinatawagan na separate vaccination center and a vaccination day for them. In the meantime, Dr. Benny Atienza, thank you so much for your time.
Thank you.
Thank you. We'll be taking a short break. When we return, we're going to talk about the no vax, no ride policy and the campaign rules for the 2022 elections. This is The Source on CNN Philippines. Please stay tuned.